Hi guys, I hope you are all doing well and I hope you guys all had a great first week at your clinical sites. I just wanted to take some time to talk about what has been going on at my clinic, my first week there, and some interesting things that I've been learning while working at a Cora outpatient physical therapy office in Kingsland. So, the first week has kind of just been focusing on learning the practices and procedures of the clinic, getting familiar with certain patients, getting familiar with certain exercises, and getting familiar with the EMR system. My first week, I have started to work one on one with some patients who I have started to kind of get to know and get comfortable with. My CI has been really good about kind of letting me be independent in looking through the plan of care of the day, choosing what I think would be best for the patient, and then adding her input of maybe how to progress the exercises for the day, or maybe, how to make the treatment of the day better. So I've been doing pretty good, I think, getting comfortable with the exercises, getting comfortable communicating with the patients, and also getting comfortable taking the patients through their treatment for the day. Um, I have been pretty independent about filling out the EMR as I go through the treatment. I am still learning how to successfully develop, I guess, more of like an insurance friendly assessment section of a SOAP note. But I think compared to Monday and compared to the end of the week on Friday, I have definitely grown a lot in learning how to write a good assessment section and have kind of been picking up some phrases here and there on how to make the assessment section better. Another thing that I have been doing this week as far as working with patients is I've started to do progress notes. I started doing progress notes, I would say day one. So I kind of jumped into it, learned the roots of developing a good progress note. It's how their progress notes flow is you're reassessing measurements, you're reassessing strength, you're taking them through some exercises, and then you're asking about how they feel they're progressing towards their goals. And here I go back talking about the assessment section, but the assessment section of a regular SOAP note compared to a progress note is completely different. So, again, I have worked on my skills in developing a good assessment section for a progress note, but I'm still learning, but it's been going great so far, and I'm learning a lot. Um, I have really tried. I have tried really hard this week to work on developing my therapy hands. So my CI is giving me lots of opportunities to develop my therapy hands as far as working on passive range of motion, passive stretching, some mobilizations here and there, and also doing a lot of soft tissue mobilization because I feel like soft tissue mobilization is something I am not very confident in. But I have found different tips and tricks along the way to really successfully deliver that treatment to patients, and I have been getting a lot of positive feedback from patients about that aspect. So it makes me feel really good about myself, and I'm having a really positive outcome this first week. Something interesting that has happened to me this week. Day one, we had a patient come in who had a knee replacement, and she started talking about her friend who also had a knee replacement. Well, long story short, her friend, I don't know how long they were post op, slipped and fell in the bathroom and completely opened up their surgical site. The fall was so bad that the surgical site was opened up so far down you could see the metal implant. She showed us a picture of his knee, and it was so, I mean, it was just like someone just ripped it open. You could see the metal implant was still intact from when they had their surgery. So It was a pretty gross picture, but it was honestly kind of cool to see how even though the tissue around it was so messed up, the metal implant was still intact. But yeah, that's something interesting that happened to me this week. First day this week. I hope you guys are all having a great time in your clinicals. I hope you guys continue to learn, and I will see you all back in February. Bye, guys.